MHPSS, Introduction to MHPSS for Children. And as we have said that this training was designed originally for the third component of the EU4Health project, which is a project that cover around 28 national society. I hope that number is correct, Cecilia, but cover a lot of national societies and mainly supporting PFA, MHPSS services for the Ukrainian population, and also caring for our staff and volunteers and many different aspects. I am sure most of you know it. And one of the extra component that was added to this project is the the PFA for children. And because we have this urgent need to start the implementation, we have this online session for PFA for children, and this would be a training to equip MHPSS practitioners who work directly with children to provide PFA for practitioners and also for PFA trainers. And basically, what we have discussed in the email that ideally people who attended this training sessions should be PFA trained. So this is an introduction in general for newcomers. And for yesterday, we have discussed what is MHPSS for children, and we have also discussed what is a child and the safeguarding policies. And we also discussed the different age group response to stress and response to trauma and response to adversity. And we have also talked about the pyramids and different levels of MHPSS intervention with children. So this is in a nutshell what we have talked yesterday. For today, we will talk specifically on a PFA. What is PFA? Why PFA for children? Why it's important for action principles for PFA, and also we will talk about how to communicate with children in general. So this would be our agenda for today. Before I start our presentation, I would like to hand it over to Kata because we have a small homework, and Kata would like to follow up on that. Kata, over to you.
Thank you, Ala. Yes, as she said, I invited you to think of an example yesterday, an example where a kid was in an emergency situation, and I asked you to think it through. How did they react? How did they behave? Was there any difference from their normal behavior or their communication? And so now I would just like to hear from you a few examples. If someone wants to share, just raise your hand, or if is it more comfortable, you can share in the chat section, and we will have a few minutes to talk about this. So I'm waiting for the examples. Please share. I'm sure that there are many differences between all these cultures, so I'm very curious about you.
I think Soli wants to share her hands up. Yes, Soli?
Yes, Soli, please.
Hi, so we're talking about the reactions of children, different reactions, right?
Yes.
So we've observed both children becoming hyperactive and hypoactive, so becoming very active or very unactive, or kind of seeking into more computers and not facing reality, more, just thinking about computers or movies and, that kind of reaction.
And how old are these children that you are talking about?
Like 6 to 9 in this age gap, maybe.
Yes,
and then also for teenagers, like this kind of attitude of, well, I don't care anymore, so I might as well do dangerous and risky things because, who cares, or like the world is unsafe anyway, so I might as well just do. And I think also for teenagers in Iceland, self-harming is becoming more and more common for teenagers. And then also bullying is one, I think, reaction from some kind of trauma is you bully other children. The list goes on and on, you know, but I think I want other people to share.
Yeah, thank you very much, Soli.
Okay,
thank you. I see the chat section. Yelena shared the situation where peers in the class are teasing the child. Should I read it out loud or, okay. So the child is 7 years old. He feels scared, anxious, he gets down on himself and doesn't want to talk about the problem at school, at home. He plays alone and isolated from other peers. In contact with other children from class, he shows signs of aggression, especially when one of the elders is present or teacher. He does not want to answer the question asked by the elders regarding teasing. He doesn't make eye contact and is visibly upset. He has bad dreams depending on the severity of the abuse. He may have sleep, eating, or even bedwetting disorders. Yes, very common. Thank you, Yelena. Another one, Timmy. A girl, 13 years old, who has been sexually assaulted. After the event, she locked herself in her room. She isolated. She didn't talk to her family for almost 6 months. That's a long time. She started to talk with her cousin a little bit, and after a while, the cousin managed to convince her to go to a specialist. After a hard year, she began to talk again with the family, and now, 2 years after the event, she's almost the same person as she was before the event. It's very nice. I'm happy for her. Thank you for sharing. I see one in serial letters. I cannot read that. If someone can read it out loud or translate, I would be happy to hear about it. Okay. Is there anyone else?
If you're talking about, this Ukrainian comment, it's
Yes.
mean that the most important it's age of children and also in this situation and also psychotype of children.
Yes. Okay. Thank you. Thank you very much. I think the last one, I really want to read it out loud, so just give me 1 minute more. So the boy, 4 years old, was in a situation of violence. After this, he started waking up at night, stopped talking, began afraid of dark place. For example, walking up the stairs in the house, regression to the younger behavior, aggression to home animals. Yes, very common. Thank you for sharing. Thank you. Okay, now I will be giving the word back to Ala. Thank you.
Thank you, Kata, and thank you everyone for sharing. This is really important to see how much we can reflect to the development age of the children and how they react and how does it fit into our the normal thing, if we could say, but it's not normal because children are different. But this will give us a little bit of indication that this child is not behaving of the same age of his age group or the things that we're expecting him to behave. So yeah, thank you very much. So let's move on to the PFA for children. I will start sharing my screen. And please, as yesterday, any comment, question, just raise your hand. Kata will be following your hands, and also put your questions into the chat so we can stop every once in a while and have comments and discussion. Thank you. Okay. Perfect. You can see my screen?
Yes.
Yes.
Yes, yes.
Perfect. So as we say, today we will talk about what is PFA, PFA principles, and of course we were going to conclude and have questions and answer. Before I start, I need to say that this presentation is adopted from the PS Center Psychological First Aid Module 3 and also the Psychological First Aid Training Manual for child practitioners by Save the Children Denmark. So what is psychological first aid? As most of you may know, that it's a description of a human supportive response to a fellow human being who is suffering and who may need support. So this is a general definition of PFA. Okay. PFA involves giving practical care and support that does not intrude, so we don't intrude to people's life, and we don't ask too many questions. Assessing needs and concerns, this is the basic principle we all know about the PFA. We're helping people access basic needs like food and water and security and shelter and any other basic support needed. Of course, it depends on the people request or they identify their own needs, comforting people and helping them to feel calm, helping people connect to information, services, and social support, and protecting people from further harm. Of course, PFA is not something only professional can give. It's not professional counseling. We all know that anyone can do PFA, and you don't need to be a counselor or a professional to provide PFA. And we actually, in our normal life, we provide PFA to our family, to our friends, to our surrounding and social circles. And sometimes we don't know that we are providing a PFA. When you see a colleague at work who is in distress, and you just sit with them and listen to them and open an honest discussion and give them maybe a hug. This is a PFA, and we do it in our daily life, but we don't identify it as a PFA. However, there's some things that need to be taken into consideration when you want to consciously do a PFA, especially when you're working under the Red Crescent and Red Cross movement. It's not a clinical or psychiatric intervention, although it would be a good clinical care. It's not a psychological debriefing. So as you know, we don't ask a lot of questions. We don't tell people, tell me more what happened. This is not type of thing. It is not type of situation that we're doing on a PFA. Of course, we don't ask people to analyze what happened to them or to put time and events in order, because as you know, it's people who has experienced trauma or experience a difficult event, they will not have the mental capacity just to put the events in order. Their brain does not process the event yet. It's not pressing people to tell their story. It's not a type of curiosity, it's a type of situation. So we don't ask to tell stories, and it's not about asking people details about how they feel or what happened. When do we provide PFA for children or a PFA? During an emergency situation or immediately after a crisis event, of course. This is our mandate. As a part of capacity building and disaster preparedness in emergency-prone areas, of course, when we prepare ourselves within our national societies to provide, to be prepared for any emergency coming, PFA training for our staff should be one of our top priorities, even if we don't have an MHPSS component in the whole national society. So we don't have an MHPSS person or an expert, but we need to integrate PFA into our activities. Like we need to, everyone, I always say anyone and everyone who interact with people need to be trained on PFA. So we need to put it in our preparedness plans and our emergency plans and train people on it. It is also when during and after crisis affecting a small group of children, and also an immediate intervention with children who have been sexually or physically abused or neglected. Okay, why PFA for children? In a crisis event, children react and think differently than adults, have specific needs according to their age, and are vulnerable to adverse effects due to their physical sizes and social and emotional attachment to caregivers. That's why it's really important to learn PFA for children. And it's also very important to know that usually children are forgotten when we put our activities, or we think about our writing our proposals or writing our concept notes. We always think about adults, how to provide things to adults. However, children are a big percentage of the population that we're serving. So you cannot just ignore them and put them aside because they're there and they have needs and they are different than adults. So one researcher study says that PFA for children, it's well received by youth, by families and providers. Someone raised their hand. Let me finish this and I can take it. And providers as well as being linked to decrease in depressive and post-traumatic stress symptoms, improve self-efficacy, increase knowledge about disaster preparedness and recovery, and enhanced feeling of safety and connection. So this study was done in 2021, which is give us a little bit of validation. But however, I felt like it's really important for us to know that our approaches of PFA, even it's evidence-based, and we can use it and say, yeah, that will enhance the mental well-being of the children, that will decrease depressive and post-traumatic stress symptoms, that will lead that these children who receive the PFA will not need an extra support or more harmful effects in the future. Yeah, who raised their hand, they can go ahead. Because I don't see the names, I'm sorry.
There's a little trouble with the Ukrainian translation. I think they are on it.
Yeah, it's working now.
So the hand raising was not a question?
I guess so. Mihai was raising his hand up.
What is the problem with translation?
Irina's mic was off. That's why she already.
Okay.
Yeah, she's back. So keep going.
Thank you. So far, no questions, right? Okay. So which children need PFA? Of course, like adults, not all children will need PFA. Some children cope very well with difficult experiences. As we discussed yesterday, children react to stressful events according to their age group, to the development stage, and of course to their cultural, socioeconomic, and a lot of things that depends on the way that they react. Okay. How children react depend on, this is what I have just said, that age, development stage, how other, especially parents and caregiver reacts. Of course, if the child see their parents are panicking, crying, and just not on their best well-being, this will definitely affect how the children react. And at the same time, if the parents were contained, emotionally regulated, and they can contain their children, this of course will positively affect the children reaction to stressful events. Of course, it depends on the event itself, like what have been happened, what they are experienced. Is it a war zone? Is it did they see dead bodies, or did they just there's no just. did they lost their homes, their friends? So it depends on the event itself. And of course, on the past experience, such as abuse, family violence, and neglect, which will negatively, I suppose, will affect on the children reaction on stress. Experiences that may affect the reactions, like loss, one or more family members or friends seeing seriously injured or dead bodies, and this has happened very often in the war zone. Like children were not protected from seeing horrible images and horrible actual horrible things. So that would lead to maybe more serious reactions to stress. Family members who remain missing after the event, and including when their body has not been recovered, but they are presumed dead. This is also one of the things that may affect negatively on the reaction of the children. Becoming hurt or sick because of the disaster or other event. This will also affect the experience of children, and also being unable to evacuate quickly in a life-threatening situation. So they have to stay within the life-threatening situation for a long time or extended time, which means that the frequency, the time they spend in fear and uncertainty is long. That's why it might affect their experience and their reaction to stress. They were trapped, delayed evacuation, loss of home, school, and belonging. And here I can relate to some experience I have recently seen, that there is some kids who were in active war situation. They're missing school, so they don't have any family members, but they're actually missing school. This one kid, he say, I want to go back to school. I want this war to end so I can see my friends and go to school. This is type of situation that kids react differently to adults. They have different needs. They have different thinking, different way to relate to things. Another story I also saw in a picture in a previous conflict, that a young lady who was holding on to her books from a destroyed home in an earthquake, and she didn't care about anything in the house except her books. She saved her books and took it with her. So this was one of the things that also stayed in my mind. Okay. Any questions, concerns? Someone wants to share something? Anything in the chat, Kata?
No, I don't see anything new.
Okay, let's move on. If I'm talking too fast, please let me know. Okay, children at high risk of strong reaction, all children who are, okay, this is continuation of the previous slide, are separated from their family or caregivers, have watched love. I think this one is, have been physically hurt and feel threatened, are worried and concerned about their parents or caregivers, are giving or concerned too, are grieving or concerned too. If the parents are concerned and grieving, this will also affect the children. Feeling guilty about surviving when others dead. This is a typical survivor emotional reaction. We can see it in adults, and also we can see it in children. There are some duplication here from the previous slide, but I hope that everything is clear so far. Children with obvious signs of distress. How we can know that this child has distress, like when I look around in a disaster? How can I know? I mean, this is actually a question to you guys. Because usually children cry, usually children panic, usually they hit the, this is a normal child.
Like shaking and
Yes.
like frozen kind of reaction.
Yes. Thank you, Solly. Shaking, yeah. I would also always start with shaking because if I hope that you're protecting yourself from going to the media, but I try my best not to go to the media. But however, whenever I see children from surviving from a horrific situation, they are always shaking, even if it's not cold, they're shaking. So yeah, thank you for sharing that, Solly. There's Muhammad, or please go ahead.
Yes, I thank you. I think generally, if there is a general change in their pattern of behavior, whether, as you said earlier, they are normally crying, they are normally sometimes over-attached, clingy to their parents. But if there is a change in this pattern, that might give us an obvious signs for the distress.
Thank you. Which national society are you from, Muhammad?
I'm from the Icelandic Red Cross.
Yeah, okay. So you were Solly.
Yes.
Nice. Great. So I have two hands also. Please go and as you like. Veronica, okay.
I wanted to mention also sleep disruptions. So they cannot fall asleep. Kids do not want to stay alone. They are looking for an adult. Also, I've met kids that were biting their nails a lot and was chewing the neck part of their t-shirts. So very under stress. So there were visible signs of distress for them.
Yeah. True. Thank
But
you for
also,
sharing. Yes, go ahead.
yeah, thank you too. Also, I've noticed that some of them develop some adaptive mechanism. So I've met children that started to draw a lot, or something like this. It's very, very interesting how they try to get better by themselves.
Yeah. Sometimes we underestimate children. They are very resilient. So yeah, thank you.
Yeah, thank you.
And anyone else? Okay, so as the colleague said that anything that are not normal or not of the things that usually this kid do, this consider maybe a reaction, and if we go to the physical symptoms, we could say shaking, headache, loss of appetite, pain all around their body, and pain around the body. This is something that you would see also, and specifically for an assault and neglect and exploitation, because they don't know how to comprehend the information and the trauma into their head, so it comes into pain. So one of the things, maybe if you are you're working with parents or with the teacher, someone is constantly having pains without any physical reason, or that you go to the doctor and there's no medical reason, this could be a sign of psychological distress and need to be deal with a professional, or someone can actually ask can work with this child. Yes, cry a lot, of course, more than normal. Panicking, also more than normal. Aggressive and try to hurt others, like hit, kick, and bite. Maybe clinging too much to the caregiver, and this is also a sign of people, of the children, they don't want to lose their caregiver, so this is their safe space, their safe person, so this is how they get their security, so they will be clinging to their caregiver. Seem confused or disoriented. You will ask them, what's your name? They cannot answer. Where's your house? They cannot answer. So this type of situation, appear withdrawn or very quiet with little or no movement, course, also this is a reaction that could be seen in a lot of children, and I have seen that especially in schools, children who was experienced bullying, they appear to be withdrawn and very quiet within school. This is one of the experience. Of course, there's other experiences that you could relate to. Of course, hide or shy away from other people. They don't want to engage. They don't want to talk. Even in children activities, if you have a children activity, you will find this particular child not really interested in talking and sitting with others or dancing or drawing or whatever. This would be also a sign of distress. Don't respond to others. Don't speak at all. This is also an alarming sign. And of course are very scared. And yeah, this is the obvious signs of distress for children. Of course, there's others, and all depend on different things, on the age, on the developmental stage, as we said. But this could be the things that we could look at when we are providing psychological first aid to children. Any questions so far? Okay. Let's start with the action principles for PFA for children. Of course, all of us are very experienced in the look, listen, and link principles. However, we need today to take these principles and implementing them into specific age group, the children. Okay. Let's start with the look. Okay, we will check for safety, same as adults. Look for children with obvious urgent basic needs, like someone with physical injury, someone who is alone without the caregiver, a kid, I'm talking about a child, of course, a child who is having the reactions that we just saw before. So look for children with this urgent basic needs, like bleeding, panicking, crying, all of this. And look for children, parents, and caregiver with serious distress reaction. Of course, if we have a parent or a caregiver who is having a serious reaction, a serious distress reaction, that would be alarming for the child that they are having or the child that they're taking care of. If one of the case studies that included in one of the modules that I have read, it says you have a woman that she's crying over her dead son, and she's crying and panicking. However, there's another child who is sitting beside this lady, who's the other child of this woman, and who is looking and seeing all of that. Who will you prioritize? Do you prioritize the mother, or do you prioritize the child who is looking to the situation? What do you think? It's an ethical dilemma, I think, but I'm interested to hear.
I think it's best to have more than one person taking care of people, and then you can invite a volunteer to take care of the child and another to take care of the mother.
What if you're alone? Like there's no one?
Well, then I would prioritize the child first, because the child is more vulnerable.
I will do the same, but as I said, this is an ethical dilemma, yeah.
But what about if you prioritize the mother, because the mother is also more capable of soothing her own child, but she needs to first become calm herself to do so. So I think it can also be risky if you, as someone who doesn't know the child, start consoling the child while the mom still continues crying. So I think you can't really work with the child when the mother is still upset.
Yeah, this is also another opinion, and I totally agree with it. However, I'm thinking it will need some time to ground the mother. And during this time, we need to think that this is an extended time for the other child who's seeing this tragedy or seeing this traumatic event. So a middle solution, this is also my opinion, my personal opinion, another solution just to take the child into another situation and work with the mother directly. Like, don't let the child continue seeing this. Like, take him to a safe space and start talking to them. Maybe take him to the safe space. Okay, I will come back to you, and start working with the mother. This is one of the solution, but there is no right, no wrong in that. Anyway,
but it might be more stressful for a child to be separated from the mother than seeing the mother in distress. So I think I wouldn't separate the child from the mother, even though she's in distress. It could cause even more stress for the child, I think. Especially if the stranger comes to the child and takes the child to another place. It sounds terrifying.
It is. Yeah, I said this is my opinion. I don't know. Maybe you're right. So, in my thinking, it's a child best interest, and it's sometimes if the mother or the caregiver does not really have the capacity to take care of their child, we as a health professional or a MHPSS professional, we need to take that responsibility, because not always you can take permission from the family to deal with the children, especially in an emergency situation. Anyway, I totally agree with you, Veronica. Is it Veronica, right?
My name is Monica.
Monica, I'm Monica. I'm sorry.
It's fine.
Monica, you're from Lithuania, right? Lithuania Red Cross?
Yeah, correct.
Okay, good. Thank you for the insights. Yeah, that's really good. So moving on. Listen. So listen is an approach children and parents or caregivers who may need support. Ask about children and parents or caregivers' needs and concerns, and listen to children and their parents or caregivers and help them feel calm. Of course, we will talk more about the listen part. We will talk. We will give more information about the techniques to use with the children, and also what are some concerns to take into consideration to work with children. Moving to link. Link is really important with children, because the most important thing always just to link the child with their caregivers, to link them with their families, because they are, as I said, the sense of belonging, the sense of security, the sense of safety. So help children and their families to help children to be united to their family, and then help children and their families to address basic needs and access services. This is really important. Help children and their families to cope with problems, and of course provide accurate, updated information. This is also very, very important in a time of emergency. Connect children and their families with each other and with social support, because this is also will help them to build their social cohesion and to start supporting each other as a group. So this is really important. But before all of that, link children with their families, with their caregivers. This is the most important thing. Any questions so far? Comments? Okay. Approaching children and families. Like when we start talking with children, or when we approach a child, especially a small child, there is some practical things that we need to take into consideration, and we need to apply. Some of them are really obvious and common that we need to do, but sometimes we need to tell people this, even if you see it like, oh, this is common sense. But when you started to work with volunteers, or training volunteers, training healthcare professionals, you're training school teachers, not all of them know the basics of interaction with children. So I would not assume that everyone knows how to deal with with children. So when you start working with children or dealing with children, you need to be at their level. Like you need to sit down at their level. If this would mean maybe you need to sit, you need to squat, you need to sit on, beside them on the floor. So you need to be at their level. Don't take them to your level. No, go down to their level. If appropriate in your culture or in any culture, touch the child gently on the hand or shoulder while you are talking. I know that this is maybe a little bit tricky in this type of region, so this is need to be dealt very, very carefully. So just tell them if it is appropriate. If it's not, because sometimes the volunteers are part of the community, so they can be to this level of interaction with children, like school teachers, and they can have this type of interaction. Others, they don't. So deal with this very carefully and tell them that they need always, always, always to ask permission and consider cultural differences. We need also to attend basic needs. Like when I say basic needs, it means food, security, connecting with family. So there's a lot of basic needs, but of course the basic needs should be identified by either the child or the caregiver themselves. Introduce yourself, explain who you are and what you do and why you're here. This is really important. Some of them are volunteers, they're part of the community, so they think, oh, I don't need to introduce myself. They know me already. No, they know you as Mike, who is working as a teacher. They doesn't know that you are a volunteer. You're a Red Cross volunteer. And now you're wearing the hat of Red Cross, and now you're providing psychological first aid. So this needs to be explicit. You need to tell them, okay, you know my name, I'm Mike. However, now I'm in type of a diversity or type of any problem in the community. My job is to talk to you and to help you. So this need to be explained, this need to be said, because the child will feel a little bit confused. And of course, when we started to say psychological, always we need to use that word in caution. Any comments? I just need to take a brief. Any comment? Question?
Maybe, Ala, you could explain this, why we need to be cautious of this word psychological. I'm not sure that everyone is familiar with this.
Yeah. Actually, it's more of it's two way. Either not to tell the people, okay, I'm a psychologist and I will give you therapy now and I will help you, so they will open up and start talking about the traumas and all the experience that they're having. This is one. And the second one is, of course, a stigma, because this will may trigger, oh no, I don't need you now. This is not my first interaction. So Monica, please go ahead. This is not what I need now. So it's have a different alarming in the head. So I always use it with caution. Just don't say, oh, I'm come here to provide you psychological first aid. I would not say that, especially to children. They will not understand. Monica, please go ahead.
Yeah, I agree. I just would add that it's also like, because psychological first aid is about basic human support. So you can just use the word, I'm here to support you. And I think the same for kids and adults. Like, it just sounds more simple, and it's also the core of it. So I think it's more understandable, and yeah, and it's actually, in essence, it's humane support for the person in distress. So that's how we can also say it.
Yeah, perfect. Yes. Any other comments?
I'm so sorry. I don't know why, but I cannot raise the hand. But I want to share that for me, it's look like also working with stereotype. For example, in Ukraine, I observe a lot that if you say that you are a psychologist, everybody say, I don't need psychologist. I'm not sick. Everything okay with me. And the same can be with children also, especially if parents of this child don't really like support believe in psychological support. So for me it's really useful, maybe sometimes tell that I can support you, I will do this or that, but not tell that I'm psychologist, I will do something with you.
Perfect. So I'd assume that you are from the Ukrainian Red Cross.
No, previously I worked in Ukrainian Red Cross, but now I'm in IOM. But it's topic interesting for me, so I joined.
Okay, perfect. Thank you. Okay, moving on. Good communication with children in distress. We need to help children to feel calm, and we can help them to feel calm if we are calm, like we have this calm tone with appropriate tone with the children. We need to speak softly and calmly, of course. Sit next to them, as we said, so you are at the same level. Maintain eye contact if it is appropriate. In some culture, it's not, but I'm not sure about this region, or how is it? Because it also depends on gender dynamic, on the age, and it depends on a lot of things. But what I know that from Sudan, that it's considered impolite just to look to the people to the eye. So you need to, especially if you're a young child and you're talking to an adult. So this is one of the cultural differences. Any experience on the cultural differences for the eye contact? I know they're a very diverse group here. Okay. Experience from Ukraine, is it how the community would see a direct eye contact? I think it's considered polite or something good, like it's a positive thing, just look people to the eye, into their eyes.
From my side, I can say yes. And sometimes if you don't have eye contact, somebody will say like, why you don't look to me? And sometimes in some of regions, it's even can be not so good if you don't have it. So it's usual.
Okay, thank you. That's really nice. Good to know. And we also need to notice non-distressing things in the environment. And also we need to breathe calmly. Like I'm not doing that right now because I don't know, I'm breathing very shallow. Like I need to take a deep breath. Okay. Any question on this slide before we go to the next one? Okay.
There is one question in the chat section. Can you explain about non-distressing things?
Yeah, that means that you need to look for the things around you, and this could be used, by the way, in grounding and to shift or distract them from the current situation. And this will be used in the techniques, in one of the techniques that we will learn. You need to focus on the things that are not distressing in the environment and use them into your conversation. I hope I answered your question. In Zoom, you cannot see any interactions, like thumbs up. This is, you cannot see, right?
Actually, there are reactions.
Really? Okay.
Like this.
Yeah, because in Teams you can see it in the screen. Here you cannot.
But can you see now what I'm doing?
No, I can't.
Oh, I see. I see. Julia also made some
Okay,
reaction.
thank you.
Sorry.
I need some validation.
Allah, for you to see this, you need to have the list of participants. Zoom, it comes on top of the participants, not popping up like Teams. But
Oh, yeah.
we have good reactions.
Thank you, Basilia.
Yeah.
Okay, good. So let's go back to the conversation and the initial conversation with children. Before we interact with children, we need to seek information about the situation. This is something very typical to when you're working with the emergency situation, and also if you're trained on the PFA for adults, you need to seek information about the situation, and this is really important. You need to be gentle and do not prop, like don't investigate, don't ask too many questions, and don't challenge the child, like, are you sure? Do you think this is, even if they say something that it's not really understandable or not believable, just don't challenge them. As I say, we need to speak slowly and calmly. We need to listen carefully and stay focused, especially with children, because children lose interest very quickly. So if you engaged with a child and you started the conversation, you need to continue this focus. Otherwise, you will lose the child like this, because even if you just look to the other direction, they will notice and they will lose the interest. This is really important, and to be honest, I am guilty of that, because when I talk with my child and I just look to my screen for 1 second, he will stop talking and he will stop communicating with me. So this is one of the things that I learned in a hard way. And we need to teach that to the people who is interacting with children all the time. So very focused. Be respectful and compassionate, of course, and meet the family with trust. Like, you need to gain their trust. You need to ask for permission all the time. You need to introduce yourself. You need always to engage the families in your interaction with children. If they are there, they're available. Any questions so far? Okay. As we said, ask for permission from parents or caregiver before speaking at length with children. When does this rule does not apply? What do you think?
Maybe when they are displaced, or
Okay. Displaced, you mean
I mean,
the whole family displaced?
Separated from each other?
Yeah, when they're separated.
Yeah.
Thank you, Solly. Yeah.
Or when parents are in such high distress that they cannot take care of themselves or a child anymore, like in total panic or collapse, I don't know.
Exactly, yes. Okay. We need to also, in our initial conversation with children, we need to be patient. Of course, dealing with child, it's different than dealing with adults. So we need to have a lot of patience, and we need to accept and support emotions. As an MHPSS person, you will understand that. However, if we're training volunteers and healthcare and school teachers who have different priorities into their mind, because the school teacher, maybe they're very good in understanding the theoretical, mathematic, whatever topics. However, they would be very hard for them to understand the emotional response and why this child is dealing this way. So this need to be sensitized. This need to be normalized. So I believe that like PFA for children, if it's going to happen in schools and we're going to train teachers, we need to spend a lot of time into the different age responses, or the different age development responses that we have discussed yesterday, the one that Kata has explained to us yesterday. I think this is really important because they will help them to understand the different reactions of kids and what is the normal reaction, what's the reaction that could be expected in this time, in this age category, and how we can deal with it. This is something that we can also teach them in PFA. So PFA for children need to include the first part from yesterday, which is the age group. Of course, offer hope. I always struggle to understand what do you mean by offer hope. How can I offer hope? But at least be positive, be optimistic, be hopeful by yourself, and maybe this will pass to the person that you're talking with. Unless someone else have, Solly. You
Sorry,
have
I feel
comments,
like
you have to offer hope.
Yeah, I'm talking maybe too much, but I want maybe to give one example that we did, or one idea that we did recently in Iceland when we are initiating a conversation with children. And so this is in a room with a lot of people, and there's a lot of things going on. But if we have stuff for the kids to do in front of them, like drawing or making like bead necklace or something, so for their hands to be first occupied is somehow very good for the conversation. Do you know what I mean? So as the initial conversation is quite good for them to have something to do with their hands. And we also have a lot of toys and stuff like that. So for the children, we found in our experience that to have something for hands to do, and then they are more open to start talking.
Nice. Yeah, this is interesting actually, Solly, because usually kids, if they have something into their hands, they will be distracted. However, there's the technique that we were going to talk about, which is called triangulation, but I'm not sure if this falls under it, because you could use that the thing that they're playing with to communicate with the children. Maybe this is one way, and if they have ADHD, which is, I think, some of the kids with ADHD, that they cannot just stand still, they cannot just focus with you, they need to have something to play with while talking to others. But yeah, that's an interesting observation. Thank you, Solon. Any other observation or other comments? Okay. Okay, what are the good communication tips to work with children in distress? And this would not be a new thing. Be patient, build trust, can take time, practice active listening. And active listening, of course, will include paying attention, show you are listening, encourage the child to talk, and respond without judging. And most of us already took a lot of trainings in active listening and how we can do it. And it's not different when you do active listening to adults than the children. It's actually a lot of similarities between interaction with adult and child. So you need to listen, rephrase, ask questions, and summarize. So most of the techniques that we use for adults on active listening could be used with children. However, that we will have some other techniques that I will talk about. How we're doing in time?
You're doing very well. We have like 50 more minutes.
Perfect. Thank you. Yeah, active listening. As I said, we need to practice the active listening as we practice it with adults. We need to validate the child. We need to be positive. We need to enhance mutual understanding. Like, you understand me, I understand you. Can you repeat what I just told you? Can you tell me did you understand? We need to reduce stress and tension. And this is one of the things that related to the non-distressing things. Like, if I'm talking to a child near a car crash, I need to observe a non-distressing situation. I need to take the child away, not only for safety, also it's not the non-distressing situation. Like, inside the ambulance, I can close the door, I can talk to the child, that they don't have to see what's happening, that people is cutting the car and taking whatever. So just reduce the stress and tension. We need to encourage problem solving, like asking the child, what would you do in this situation? How you can solve it? Did you have it before? How did you manage? What do you think your parents would do in this situation? So encourage always problem solving like adults, because children really like to be engaged and participating. And if you ask for their opinion, they will feel like kings and queens, and they will shine, and this will boost their self-esteem, improve feelings of safety and hope. This is the same how we can improve feelings of safety. Yes, hope. I hope so. Any questions or comments before I move to the next slide? Okay. Elements of the active listening, like attentive focus. Of course, as we say, you need to give the child all your focus. We need to do the rephrasing. We need to do the encouragement to talk. We need to do question, not questioning, like asking questions and clarification, and of course, summarizing. This would be the elements that an active listening. And people who's working in MHPSS, who's a psychologist or social workers or working for a long time, it's actually in our system. And this is something interesting that I always trying to pay attention to. Like, we are using active listening in our daily life without noticing. Like, it's like in our genes now. However, we assume that everyone like us, which is not. And you could see that people always ask, how do you connect with people so often? Say, oh, it's my job to connect with people. So, but it's not something that happened naturally. No, it's learned. So when we train first line respondents, when we train healthcare workers, when we train school teachers, we need to give a lot of time and effort and to teach them about active listening, giving role plays, spend a decent amount of time and to teach them how to do rephrasing, how to do questions, how to clarify, how to summarize, because it's not something easy to do, and it's need a lot of practice. And if they learn how to do an active listening, that would be the perfect scenario. And actually, I think it's 90% of the PFA. Sorry, it's just my opinion. Don't take it. Okay. Any comments? One of the things that's really important is not to talk too much, just listen, and block out any distraction, like look for non-distressing situation, do not interrupt, be aware of your own body language, and recognize and control your own listening barriers and emotional triggers. And this is really important. And when we're trying to train, as I said, all of the people that we need to train, we need to, before they start working with children, they need to understand their own barriers. They need to understand their own emotional triggers, because they need to be aware of it. And if something happened within the conversation, so they can at least regulate themselves and try to give a support to the children. I hope it's clear. Okay, I'm moving on. Paraphrasing, we repeat keywords, mirror what was said, describe rather interrupt, and be aware of nonverbal contradiction. And this is also very important, because if the child say that yeah, I'm happy, I'm okay, I'm fine, but they're not, and it's obviously that this child is neglected, is having no shoes and very dirty clothes, and so you can see that that this child is not okay. As I said before, when we train, when we provide the PFA training for children, we need to spend more time into going into this techniques. Of course, because we're doing now an online training, the perfect scenario would be that we do all this interactive role plays just to enhance our active listening skills. However, you will have more opportunity for you when you train, when you provide the PFA for children training, that you will have more liberty to provide role plays and activities and exercises. And as we said before, that we will share with you a lot of handout, a lot of materials that, of course, the manuals that you could use to develop your training. And of course, you can use these presentations. Okay, let's talk about encouragement, like convey warmth and positive feeling, and verbal and nonverbal encouragement. Can someone tell me what's the verbal and nonverbal encouragement? Verbal is it's easy, but nonverbal.
As it could be by by using your hands, by using the eye contact, by nodding the head. You know, there are different nonverbal encouragement that we can use.
Yeah, I'm not a child, but when someone gives me a thumbs up, I will feel encouraged, like right? Yeah,
Right.
so it's yeah. A lot of high fives, thumbs up, nodding. So we need to use that, because as an adult, sometimes we forget to use the nonverbal encouragement. Okay, perfect. Questioning and clarifying using open-ended questions like, where were you when it happened? What was the time? Something like this, but I would not go for where is the time though, so just ignore that. It will be more not a yes or no question, and maybe who, why, where, and something like that, and when. Explore topics that are relevant to the child perspective and experience. So it's like, if children in school age, we can always talk about school. If they go to the kindergarten, we can always talk about playing and friends. And so we need to relate to them. And of course, we need to avoid any investigation, any propping, any curiosity that will not help the child, rather than helping our own curiosity and asking questions. Okay, any comments? course, summarizing, it is something used with adults, and of course should be used with children. We need to reflect on what the child has been saying through the conversation, and we need to tell them, so this is what you told me, 1, 2, 3, 4. So identify and reflect key important points and messages that the child has raised, and tell them tell to them, not because they're a child, that we don't use summarizing. No, we use it, and actually children really appreciate somebody who acknowledges them as adults, and not an adult, like acknowledge them like someone who understands and give them more the information, and try to treat them like you treat an adult. This is the right way to say it. I pause for a few seconds just to see if someone wants to say something, but Andrea, yes, please.
Hello, can you hear me now?
Yes.
Super. I wanted to mention something that I found very important from my practice. As I said, I'm a pediatrician and I also a PFA trainer, and we are working with children from Ukraine. And of course, I don't speak Ukrainian. And usually some of our colleagues from Ukraine who speaks Ukrainian and English help us with the translation. And sometimes I'm asking what the children says, like nothing, like childish things. And I think it's very important to mention that we have to be very careful of what the child is saying, because it can help us a lot, and not to enter in this what did he tell, or nothing important, because for us as helpers it can be very useful.
Yes, that's totally true. And I struggle also with the translator, the same in many situations. Yeah. I remember we had group sessions for Syrian kids, and we need to translate into English because we have one visitor or whatever observer, or and it was really difficult. Like, it's a group session, it's kids, because kids will interrupt each other, kids will talk nonsense. Sometimes they will say something is not relevant within the group session. So it's not the ideal way, but however, we're trying to help. So the lesson learned from this, that if you don't have a native speaker for a group sessions, that's not ideal, or it's not really the right way to go. And also we need to take into consideration that the translator give us the full information, like not only summarizing by themselves or give you the gist or what they understood. No, they need to literally translate. And then I have one slide also for translator, because also it's a struggle, and it's also a challenge to use a translator with working with children, because child will go from one topic to another without focusing, and for the translation to feel or sounds nonsense. Thank you for sharing that. Any other comments? It's here. So select someone you trust, explain how you would like to communicate, ensure that the translator is aware of his own role. So aware of the role, that means that they will not summarize, they will not put their own words into this. So literally translating, and do not criticize, but double check. And so if you hear something that does not make sense, you need to re-ask the translator, oh, you said this, can you ask to repeat, or can you again translate that again to me? So you need to double check and be aware of gender issues. Of course, this is a cross-cutting issue all the time. Any experiences with the translators, especially that we're working with Ukrainian children, and we're the ideal situation that we have Ukrainian MHPSS providers, but however, this is not the case. So we use translators. So any experiences? Okay, I would assume. Oh, Andrea.
I see a hand.
Yes,
Yeah,
please.
so sorry. So we are working a lot of translators, and at the beginning was very hard because the translators are not professional translators, and they are doing their best to communicate us what our beneficiaries are saying, but still we didn't made like a common agreement of how we should work together, and it's not to say to us the general impression of the beneficiary and to say exactly word by word of what they are saying, because I have to go through my filter of
Yeah.
thinking and know theirs. So it was, we worked very good after we put all this in place and we agreed how to work together.
Okay. Yeah, that makes sense. Okay. So language is a challenge, of course.
Sorry,
Yes,
I
please.
cannot raise the hand by the app, so just I put the camera. When we are talking about translation with kids, we have to choose the group age that we are talking with, especially with the child. If we are talking about like 10 to 18 years old, that they are also considered kids, it's good to use a translator. But when we are talking with kids younger age, that we say like under 6 years old or under 9, 10 years old, it's not recommended to be with a translator. I'm talking by experience. I have 16 years of experience working with kids in Syria. Now I'm working here at the Red Cross of Iceland, Icelandic Red Cross. So if we are talking about translator, it's not recommendable with kids in the early age. They need someone with the mother tongue to talk to them and express themselves properly. It has to be a very close relation. I mean, like the kid has to be has to feel that he's safe in a safe environment so he can express himself properly. Thank you.
Perfect. Yes, thank you.
Thank you.
Tausan, right?
Yes. Yeah.
Yeah.
Yes.
Yeah, that's great. Yeah, using a translator is something that we need to take into consideration how to use it. We need to sensitize our translators. We need to also train them on the same topic that we are talking about. We need to include them. This is part of the mainstreaming that the MHPSS should do across sectors. And also when we use a translator or interpreter, this need to be taken into consideration, because I usually ask when I use any interpretation, even if it is a high level event or as a training, that I need to sensitize the translators or interpreters about the jargons that I'm going to use, because what feels to me that very normal, like saying MHPSS, it might be a new concept to another person. So you need to sensitize, you need to sit with them, need to give them a lot of information before you start working with them along with beneficiaries. And I would not say not to use translators or interpreters when we're working with younger children. However, we try to find as much as possible someone who speaks the native language or the language of the children. This will enhance the connection. This will enhance more communication and validation of the kids. So this is why we think it's really important just to pass the knowledge into the people who already speak the language of our target beneficiaries. So when you start to select your trainees for the PFA for children, I would recommend going for someone who speaks the language of the target population. Okay. culturally sensitive communication with children. This is something we already discuss it. We already discuss it throughout the presentation. However, it's very important just to go through them one by one. We need to, of course, respect diversity and diverse cultural backgrounds and any differences that we can see from the beneficiaries that we are working with. We need to accept it. Of course, language consideration, we have been talking about this, be inclusive with a clear language. Of course, when we do MHPSS interventions, we need to have the tools, and the tools should be within the language of the target beneficiaries, and not only the language, also the pictures. When we use animation and when we use any picture, it needs to be inclusive. So this is one of the things that need to be taking into consideration. Nonverbal awareness. Of course, we need to be mindful of cultural differences in gesture and body language. This is also depends on different cultures, because I was told that many face expressions means different things in different cultures. So in my cultures, this means no. In African culture, this means yes. So I was totally confused. Basilio, correct me. This is mean yes in your culture, right? Raising your eyebrows up. Also, this have a different meaning. This have a different meaning. This has a different meaning. So we need to be aware of all the facial expressions and other body language expressions. Also, cultural symbols, culturally relevant visuals, as I say, like pictures and other tools. We need to look for family and community dynamic. We need to recognize the influence of family and community on a child's life. This is considered being culturally sensitive. Of course, we need to respect the religious beliefs and practices without assumptions and judgments. We need to be adaptable for different cultural contexts. When I mean adaptable, like if they have a specific holidays, that we need to respect that. And if Sunday it's no go for doing any activities, we need to respect that. So we always need to ask. We need to participate. We need participation from the community. We need participation from the kids. We ask them, what do you prefer? What do you think? How are we going to do that? We're going to build an MHPSS intervention for children, do a focus group discussion with children, not with the adults, with children, and ask them, do you like to do this or do you like to do this? So a lot of things could be done when a participation approach is taken into account. Safety and disclosure. Of course, we need to create a culturally safe space for children to share experiences. And I'm admitting people now. Ongoing learning, like, of course, we need to educate ourselves. And now getting information is the easiest way that have been ever since I don't know since when, but it's really easy to get information via different tools and AI platforms. So a lot of things that could be used to get information. Any question, comment so far? Be aware of this time.
Yes, it's 3:30, so we have like 50 more minutes until the conclusion and Q&A.
Okay, perfect. So this is also a slide that we already talked about, so I would not go through them one by one, but I would start with the techniques. So there's a lot of techniques could be used when you're communicating with children. However, we didn't have the chance to go through all of them, but some of them that could be used, maybe three. I think I only used three examples, but I will share with you I think it was 6, and in the document, yeah, 6. So I will share with you all the handout with all the techniques that you can use. So the initial contact, when we talked about this, but however, this is really important. That's why I put it there, because we need to say name, who are you working for, why are you there. Always begin by explaining who you are and what you're doing. Speak softly, slowly and calmly. Try to sit down next to the person or crouch down to talk to the parent or the child, so you are the same level. This is a repetition, I know, but this is really important, that information that we can take and pass into the people that we are going to train on PFA for children. If it is appropriate in the culture, maintain eye physical contact, such as holding the parent's or child's hands, or having your arm around the person or in his or her shoulder. Even if the child knows who you are, this does not mean that they know your role or responsibilities in a particular situation. As we said, you might be a teacher, however, not a teacher, you might be working in a grocery store, and in a terms of adversity or at a particular situation, you will wear the Red Cross vest and go to help people and provide psychological first aid. So you need to reintroduce yourself and tell them what they are and what you are doing. For example, when a difficult experience like this happened, my role is to talk with children in the camps to see if there is anyone who would like to share their thoughts. So this would be an example of how the people could introduce themselves to the children on the initial contact. Technique number 2, which is how to gain information, and of course we will use open-ended clarifying a question, which is usually not yes or no question, but this is why, when, where, what, and who. Children are encouraged to tell their stories in their own terms and from their own perspective. Example: where were you when it happened? Or how come that you did not eat anything today? Example for clarification questions: I am interested in hearing more about this. Can you give me your thoughts? Or are you saying this and this and this? Do you mean this and this and this? So using these open questions can help you build the relationship with the child and start the conversation, and maybe identify their need faster. They can clarify what happened and give you information about their feelings and thoughts. When facilitating a psychosocial group activities with children, open question encourages active participation among children, creative thinking, and problem solving. Any question? This is mainly something very, very obvious, but I thought maybe this is very practical, that could be used in the training. Or if you are already the one who is already providing PFA for children.
I see a question in the chat section.
Yeah.
How should be the tone of our voice? Be joyful or more calm and quiet? It might differ with the age of the child. In general, not in the specific situation.
This is a question and you answered, or this is the whole question?
This is the question.
Oh, because I felt like the question answered itself. Yes.
Yes.
Yeah, it depends. I would not go for joyful, especially if it is a crisis situation. However, giving more hope, being positive rather than negative, but calm, that will calm the person in front of you. Like use your calm, soft voice, and of course you can assess the situation. If someone is really agitated and very having strong emotions, and you started to talk with them slowly and calmly, you will definitely give that to them and they will start to be more calm. I hope that I answered the question, but the one who answered the question already have the answer.
Thank you. And I see another question. If you're not an MHPSS expert, how do you determine when the child needs more help than you can offer when you provide PFA? Maybe
That's
this
a
is a
perfect
question
question.
for the Q&A.
Yes. Yeah, we have we will talk about this, but this is an excellent question, so thank you. Okay. Okay, let's talk about stabilization, and this is also related to the question was asked. Use calm, low, comforting voice, non-threatening body language. Also help other techniques are also helpful. One of them is called the grounding. Of course, the grounding it's a very famous technique, and the grounding could be done with children as we do it for the adults. So it's the same technique and the same thing that we could use. We could distract the child of the non-distressing things happening around them in the environment, and we can tell them, okay, can you see the clouds in the sky? Oh, it's it's very weird that today it's sunny, and although we are in middle of January, so this could be something distracting and a little bit grounding, because I am relating to something happening now, and shifting the attention from the emotional from the strong emotion that it might be happening within the child. The second point here, I already talked about it. If they look disoriented or they look panicking, we could use distraction. I sometimes just give them something in their hand, as Soli said, like give them something in their hand to play with. If someone is in a severe injury and you suddenly tell them, oh, what is this? This is a pen. They will be distracted from the severe injury, from the injury, not the severe injury, from the injury. They will be a little bit they will shift their attention. They will calm themselves down a little bit. I'm not sure if this will help, but this is one of the techniques that we could do. Is it you, Kata? Yes, please go ahead.
Yes, I would just like to share a grounding technique, which is very similar to this one. It is called 5, 4, 3, 2, 1 technique. We have to look for 5 things, 5 different colors maybe, and name them. Then we have to name 4 different things that we hear. If there's silence, it can be our own blood pressure, which we can hear if we press our ear or something like that. Then we have to look for 3 different things that we can touch, we can feel. Maybe it could be the sweater on my skin. And then 2 things that we can smell with our noses, and then with our eyes closed, 1 thing that we can taste. And this is I've used it many times, and this works very well with little children, because this grounds them and makes them more mindful of what is happening right now and calms them. So I just recommend this for you to use it.
Perfect. Thank you, Kata. Any other grounding techniques that people wants to share and with the group? Okay. Another thing that we could use as grounding is focus on the breathing and encourage breathing deeply and slowly. So focus on your own body. This is also used as part of for grounding. We also, if a child reacts negatively, for example, they are aggressive, they started to hit people or smash things or having a strong emotional reaction, we would need to validate their emotions. We would need to encourage them to cope with their emotion. However, we need to tell them that this type of behavior, this type of anger will not help, and will not and acting out these feelings will maybe escalate the situation. So we need to de-escalate and a potential conflict by saying, is it okay? It's okay to be angry, but please do not hit others when you are angry. When you are angry, I am here to take care of you and to keep you and your friends safe. So this is one phrase that could be used with children who's having an aggressive behavior. Okay. Moving on to the fourth technique, which is triangulation. So sometimes children, especially young children, feel a little bit intimidating and scary and scared to talk to strangers. So you will try to engage with them in a conversation, but they will not talk directly to you. But they will talk to their mothers, and they will not talk with you. So one of the techniques that could be used, that you talk to the child through a person or through a toy or other object. And this is one of the things that we were talking about, like we use a photo, we use a whatever character in a book. So this triangulation technique could be part of the conversation, but we need to know that we need to keep the focus on the child, like not to distract the conversation. If we start to talk with the parents, like talking about the needs of the parents, but we need to keep it within the child. That would mean you should still relate primarily to the child to make him or her feel that you are focusing on them. For example, if we ask a child how old he or she, but they remain silent, you could say, "Can I ask mom about it?" And if the child nod yes, then you can ask the mother. Confirm that you still are focusing on the child, and then get back to them. Oh, so you're 5. So this is how you interact with people, how you interact with children who's a little bit shy. Sometimes this triangulation work, and even the shyest children usually start talking if he or she feels safe and secure and a little bit distracted about their emotion. If they are not with their caregivers, so there's no mom and dad that are there, we can use a toy and a puppet, anything that that the child you see clinging to, and this would mean using that as a way of communication with children. So one of the examples would say, your teddy bear looks tired. He must have walked a long way today. Maybe he would like some water. Would you like some water as well? This would be one of the techniques, of course, for younger children.
Ala, you have 3 more minutes for this section.
Okay, thank you for that. I think I'm almost done. Supportive communication, this is also one of the techniques, but maybe could be used with younger and adult children. Which means that to be positive and to use positive phrasing, like you're good in a lot of things. I can see you have done your best. And we do not use negative rephrasing, like you are not good in this and you always fail in this. Give clear and positive instructions. This could be used by people who work directly with the children, like a caregiver, like a teacher, maybe a healthcare professional, and a volunteer who's engaged in a school activity or in extracurricular activities. So this could be one of the tips that could be used, like do's and don'ts. So I put it there because I think it's very important to give these tools to implementers. So the link part, of course, the link part is, as we say, the same as adult, is identifying the most immediate needs and address them, provide accurate information, and of course, link to service providers. Look for specific services that are for children. We need to connect them with their families and with each other, with the families to each other. We need to provide accurate information, of course, and help children and their families to access support and services. As adults, children, not all children will need MHPSS support, but they will recover faster if they are reunited with their parents and caregivers, if they have their own basic needs met, if they feel safe and out of danger, and if they receive support like psychological first aid for children. This is the answer of one of the questions. Who are the children who may need extra help? We would say someone or a child who remain very distressed, like the emotional reaction continues for a long time, maintain dramatic changes in personalities and behavior. So we can see that there is changes and big changes, like social withdrawal, loss of appetite, disturbed sleep. There's a lot of things changed. Cannot function into their daily life, and function for children, it means playing, going to school, and doing their interaction with friends. So this is what we mean by function to children. Feel threatened, always scared and not feeling safe, and of course at risk of doing harm to themselves or other. If a child is severely distressed, avoid leaving them alone. Stay with the child until the action are passed or until you can get help from others. This is really important message that should be passed to the people who is working with children. This is one of the tips that could be given to the parents and how they can deal with their children. And a lot of national societies, I know that they're preparing activities for in the schools, and of course activities for children. So this could be helpful in parents sessions and psychoeducation. So these tips could be given to the caregivers. If I have time, I can go through them. If I don't, I cannot. What do you think? Do you want me to go through them? They're very basic.
Maybe 3 more minutes than 10 minutes to the questions.
Oh, that's fine. I know that the last 15 minutes are set for questions and an answer, because we're already taking questions and answers during the way. But I'm just including the participants. Do you think this is very clear and we can just move on to the next slide?
I think that yesterday there were not that many questions, so keeping that in mind, please pace yourself, Ala. So I don't think there will be many questions at the end.
Thank you. So what are the things that we could give to the parents and which we can tell them how to deal with their kids? It's very important to reestablish the daily routine for children, like preparing meals, going to school, doing daily chores. Returning to the daily routine is one of the things that help children to recover very quickly. And we always say to the parents, don't introduce new things or new changes in their lives, no new restriction after a traumatic event. Like leave them for another time. So if you want to teach your child, I don't know, what are the things like maybe changing the sleeping time from 8 to 7 or from 9 to 8. This is not the time for it. Leave it for another time. If you want to teach them how to be responsible and doing new things at home, also this is not the time, leave it for another time. Make sure that the children are well rested and sleep well. Allow your children to engage in activities like drawing and encourage them to play with other children. This is really important, especially for people who's migrated from one country to another. This would be a little bit challenging because they left their family, they left their social interactions or social networks. So they need the families or the parents or the caregivers are encouraged to build new social connections and maybe go to the playground and meet other people, so the children can still feel that there is a place to engage with activities. Try to maintain contact with family and friends. It can support and comfort your child. Also, it's important for many children. It's important for I think all the children, not many children, to have a more physical contact, like hugs and cuddling, which is actually very, very important for their cerebral development and their emotional development, and cognitive development as well. Don't leave young children alone or with people that the child does not know as well, because in a changing, life-changing situation, sometimes we tend to trust people that we don't know that much. So be careful. We need to tell the parents to be careful about that. Talk about your feelings in an appropriate way, in an appropriate way, and allow your children to talk about theirs. So tell them, I am overwhelmed. I'm sad because I left my country. But at the same time, don't expose them to a lot of news and my friend died, or putting the news channels all the time. This is something very important, and we need to eliminate that, and we need to limit our time of watching the news. Lovely. Yes, you're here, Lovely. I did not know. Please go ahead. Is it by mistake, or you change your mind?
It's not by mistake. I was muted.
Okay.
Thank you so much for the great presentation. Just very quickly, when you spoke about advice to parents and hugs and all that, which is really very important. It makes a really huge difference. I think what we must also be aware of is that some children who are on the autism spectrum, that doesn't work for them. It really irritates them. It really makes them worse. Even the type of clothing that they need to wear. For some, they don't want to wear anything else. So I just thought to mention it for us to be aware that it doesn't work for all children. And it can be just even a small aspect of the autism spectrum, but I think we just need to be aware of it. Thank you.
Thank you, Lala. That's perfect. Thank you. Any other comment? Okay, so the last 2 points in this slide is protect against disturbing reminders, like what we say, like news and all of that. And as a parent and a caregiver, you are the most important. They need to know that they are the most important people in the children's life. This is the few tips that could be given to the parents and could help some building some activities. Okay. There's this nice poster from the PS Center, is how to talk with children about war. This also could be used as a handout. I think we have it in Ukrainian, so I will also share it with the handout. So it's helpful. I like a tool that you can use within your activities. This is also one of the things that we already talked about. And who do you refer children to if a child is in severe distress, or he or she should be linked to a professional support. and you need to know what are the available resources in your area. This is really important. And I always say that MHPSS practitioners need to know the available services around them. So a small mapping, it's one of the most important things that could be done before we start our MHPSS interventions. And because when you're providing PFA and you don't know the services, you're missing the link part. So familiarize yourself about the services around you. Sometimes the information it's available. It's not really hard to get, and how to do the referral should be also identified either by the national society or by the organization that you are working with, like school or health centers. So there should be a referral mechanism. It could be very simple, like we know that where's the professional help and we know the address and we can give it to the parents. But just this thing need to be addressed when you're providing the PFA for children. I cannot see the address. This is, I think, it's children at risk. And who are the children that need more extra support, or what are the alarming signs? And I think this is also was one of the questions from you. If the child is at risk of harming himself, herself, or others, this is also this is very important. If the child expresses suicidal thoughts, if the child shows extreme resistance, withdrawal, with no emotional response, and the child expression seems flat with no negative or positive expression. Okay. If the child is persistently whining and uncontrolled crying over time, this need a professional support. This need extra attention. If the child is dissociative, if the child is detached from surrounding and fails to engage emotionally. If the child is experiencing hallucination, like hearing voices, hearing voices or seeing people that they are not there. So either auditory or visual hallucination, this is something, of course, we need to refer. If the child is experiencing resistance, anxiety attacks or panic attacks, if the child is showing signs of mental disability, like they cannot perform well in the school, they don't understand the language, they don't have an interest and ability or capability of doing social interaction. This is the signs, the alarming signs that we need to take care. So before we go to homework, any questions, or we only have 3 minutes. Questions,
I
concerns?
see some questions in the chat section. Dear organizers and Ala, I think it's more a practical question. Thank you for the useful event. Will we receive the link and info only today? Is it possible to watch recording part 1 and 2 and 3 also? And are there any certificates of completion provided for the participants?
Certificates, I need to discuss it internally first, but I don't see any problem with that. However, it needs to be discussed. The first question is about the material. You want us to share material.
Yes,
right?
I think so.
Because we will. All the materials will be shared with the handout and the manuals that we use to create these presentations. Sorry, I need to let my son in. He's on the door. 1 second.
Yeah, meanwhile, maybe I can remind all the participants that we are holding this PFA in Zoom platform. We had to switch to Zoom because of interpretation option. So make sure that you're joining Zoom, not the Teams meeting. And tomorrow I also will share with the link to the third session. But in initial email, I have shared it with you already. But just in case, I will share it tomorrow as well. Kata, Ala wanted to say something to finalize it. Yeah.
Sorry, I did not get the last part, but however, I will go to the homework part for tomorrow. So for tomorrow, we will prepare please prepare a short description of MHPSS activities for children, because tomorrow will be more of a practical application of how to use the PFA into building an MHPSS activities for children in schools and other than schools. So please try to share your experience. This could help other national societies in building their own MHPSS activities. Yes, Monica, please go.
I just wanted to make sure, do you want to hear examples from Red Cross national societies? Like, what are the activities organized in Red Cross national societies, or generally from our practice as people who work with kids or psychologists and stuff?
I think it would be helpful to share experiences from national societies and outside national societies, and outside the Red Cross movement, maybe you mean, but any activities would be helpful, because I believe that building activities from scratch for children is not an easy thing. And there's a lot of things need to be taken into consideration. However, a few basic things could be could be done. So we don't have to go to the second, third, or fourth level of interventions. We can stay in the basic part. All of this will be discussed tomorrow. So please think about it, share your experiences. That would be very helpful for us.